lots of reasons why surveillance data as a whole for any communicable disease is usually an underestimation of the true burden of disease in the community. So you can look at things like salmonella, where as many as 30 cases for every 1 case that are reported may have gone on undiagnosed and underreported. So this is a pretty common limitation to public health surveillance data. But as I've said before, as long as the rules or the processes don't change dramatically based on some external influence, we still very much can rely on the trends that we're seeing. So again, it's not 100% accurate, but the trends are very reliable, and we learn a lot from those trends as we go about making decisions about allocating resources. Where do we need to do pop-up testing? What messages do we need to send out? What rumors do we need to squash? Those sorts of things. So super helpful in that regard, and really one of the few things that we have to combat COVID-19 with, since there's no vaccine and no widespread treatment availability. All right. Continuing to get, I have like 3 pages of questions today, so I don't know if I'll be able to get through all of them, but I'll give it my best. Do my best. A lot of the questions are circulating around people who observe that the Safer at Home order is not being carried out in workplaces. It could be a business, it could be your place of business where you work, it could be a restaurant, could be a big box store, could be a hair salon, but we're starting to get a lot of feedback from, now that there has been limited reopening, getting a lot of feedback from the community members really worried about the fact that businesses don't seem to be applying the recommendations and the orders from the Safer at Home order, or they're doing so inconsistently, and people are concerned about that. One way to not be concerned is don't go. You are safer at home. So if you are concerned, if you walk into a facility or a business or a restaurant and you feel that they are not properly implementing social distancing, mask wearing, disinfection, those sorts of things, just leave. We can accept complaints through our iscomplaints@mchd.org email address. Just a month or 2 months ago, we didn't have the bandwidth to respond to all of the snitch reports, is what I call them, for lack of a better word. But when people were, tattletaling on folks in the community, we just didn't have the bandwidth to respond to that. We have developed some teams and some capacity to consult with these businesses by phone. And so if you know of a business, whatever kind of business that you feel is not complying with the Safer at Home order, you can send the information through our normal inquiry line, and it will get to me, and I'll make sure it gets to the right people. If it's a permitted establishment, so a restaurant or a tattoo parlor or a pool, a daycare, something of that nature, it can go to iscomplaints@mchd.org. And we likely won't issue a citation or a violation. The meat around the emergency rule, the state health officer really has to be enforced by law enforcement. However, we are trying to take more of an approach about informing and educating. So if we talk to the managers or the owners or the shift supervisors, we try to just talk with them and again, come from the place of, we'd like to make sure that you're informed and that you have the materials that you need to make good decisions to keep your workplace or your facility or your restaurant safe. And that is the way that we want to work with our community, not in a punitive way unless the violations are egregious, but in a way which we can partner to inform and educate to try to reduce risks. So what is the optimal quarantine period for someone who's newly exposed? So if you are exposed to someone who has laboratory confirmed COVID-19, the quarantine period is still 14 days, has been 14 days for most of the epidemic. What we're advising now is that you get tested at 5 and 7 days, and then at 12 and 14 days during your quarantine period. Of course, if you become symptomatic, you need to get tested immediately. But if you are exposed and you don't have symptoms, please get tested 5 to 7 days after your exposure, and then 12 to 14 days after your exposure. And anyone who needs to get tested can call 690-8889 and schedule an appointment to get tested at one of our 8 family health locations at no cost to you. Let's see. Other questions like how soon, when you're infected, how soon can you be infectious to others? This is really difficult to define there, because certainly when you're symptomatic, you're probably spreading germs 2 days, 24 to 48 hours before you become symptomatic. But if you don't have symptoms, we don't know how long you might be spreading germs before you have a positive test. So it's really tricky, which is one of the reasons, that uncertainty is one of the reasons that we want people to be wearing a face covering, right? So if you have been exposed and you or infected and you don't know it, wearing this face covering will protect others from your germs. Let's see. I have a comment here. Someone was, maybe not a complaint, but commenting on Facebook that that we report the name of a complainant when we receive one. And it is true that previously we would not receive anonymous complaints, on our complaint line. We're in this situation, again, we need you to email us, but we don't reveal the identity of the complainant when we speak with the business. They may find out who it is through the conversation. If I say, well, we were informed yesterday by someone who said XYZ, they may be able to figure out in their mind, oh, that was that customer that demanded their money back. So, but we don't give the business owner or manager the name of the complainant. But remember that all government records are public records. So someone could request, under the Freedom of Information Act, could request complaint information and receive those complaints. And that has indeed happened before. Let's see. Here's another question. Is it possible to carry the virus without getting the disease? You can carry the virus and not be sick, not have symptoms. So yes, you can be infected and not have disease. Let's see. Any word on Mobile County students going back to school? So we have already been alerted by the state health department and the and Commissioner Mackey, Bob Mackey, no, that's a dressmaker, I think. Anyway, Commissioner Mackey, that Friday at 10 o'clock, Commissioner Mackey and Dr. Harris, the state health officer, will have a joint press conference to release information, guidance to schools. The Mobile County Health Department Prevention and Wellness Division has formed a group of people who will contact all of the public and private schools around Mobile County and let them know that we are here to consult with you as you make decisions about reopening. Everyone is saying that it's probably going to be a lot of on-campus learning in the fall, and we just need to figure out a way to do that safely. And so our Dr. Stephanie Woods Crawford, who's the executive director of our Prevention and Wellness division, is leading that activity with Brad Phillips, who's our director of inspection services. Let's see. Someone asking why the state dashboard seems behind. Initially they were updating the data all throughout the day, and I think people maybe got spoiled by that. Now they only update it once a day, and I think that's in the morning. So it may seem like they're behind, but I think it's maybe just seems that way since they only update it once a day. Sometimes when they need to take the dashboard down to make changes, like share new data or new types of data, they do take it down and then bring it back up. But there is no, there's no conspiracy to try to suppress data or try to hide data. You are getting it in near real time, and often, this is just unprecedented release of information to the public than I've ever seen in my lifetime as a public health practitioner. Question about, can you relapse with the virus? I think the jury's out on that one right now. It's unlikely that you would relapse, but you could be reinfected potentially. But again, this is still very early in the science around COVID-19, this novel coronavirus. So we'll have to just wait and see after we've been able to gather more data and science around this. Let's see. A lot of questions again about restaurants with positive employees. When should they close? Who's the enforcer? Some of these are sort of repetitive, but I'll say again that there are guidelines for restaurants with regard to capacity, social distancing, sanitation, wearing masks for any worker who is interacting with the public. If restaurant workers cannot maintain a 6-foot distance from each other, then they would also need to wear a mask to protect themselves. If an employee or a restaurant goer is positive for COVID-19, the health department would likely not report that to the business, but if it's reported to the business owner and they have concerns, we are happy to consult with them. In general, if you have some idea about where the exposure might have occurred, then you may not necessarily have to shut down your entire business. But we are happy to consult with you on that and help walk through some of the guidance to make sure that you not only adequately disinfect, but that you put some of these measures in place to try to prevent you from having to shut down. The Safer at Home order and all of the guidelines was put there so that you could safely reopen. And when you don't follow the guidelines, then you put yourself at risk of having to, oh, I've got an employee and I wasn't following the guidelines, so now I guess I have to shut down. We don't shut places down. We don't order their shutdown. They decide themselves when they want to do that. Again, asking about enforcement for wearing face coverings. You can report it to us. We will call them and talk them through it. But there's not a lot of law enforcement closing restaurants at this point. Let's see. All right. I think that might be all for the questions and answers that I can get around to answering today, because there are quite a lot, and most of them, are around this restaurant situation. Again, the state health order right here and the guidance that came with it was designed to help businesses safely reopen. And if you have opened and immediately had a COVID scare, then use the time that your facility is shut down to do better with regard to your precautions for keeping COVID out of your establishment or containing COVID if you do have a worker or a shopper or a diner who has COVID. Okay, yesterday I was picking on close contact retailers like nail salons and hairstylists. Today I'm gonna pick on retailers. So just to, again, very plain here, all retail stores shall comply with the following rules. Emergency maximum occupancy rate. Occupancy shall be limited to no more than 50% of normal occupancy load as determined by the fire marshal. Social distance. An employee of the retail store may not knowingly allow customers or patrons to congregate within 6 feet of a person from another household. So retailers, it is your responsibility to make sure that your shoppers are not within 6 feet of one another. They also have a personal responsibility, but if you observe it, then it's your responsibility to ask them to please, maintain a 6-foot distance. Sanitation. The retail store shall take reasonable steps to comply with guidelines on sanitation from CDC and the Alabama Department of Public Health. This involves increasing the frequency of disinfection, disinfecting high-touch surfaces, making sure that you close off areas that may have been exposed, disinfecting them and letting them sit for 24 hours before you reopen them. So again, if there are any retailers out there that have questions or have not been able to, understand what it is that they're supposed to do, please contact us and we will happily set up a consultation with you so that we can help you protect your business and protect our community by keeping COVID transmission limited in your businesses and facilities. So having said all of that, I'm going to stop here for today, and we will talk to you again tomorrow, Friday, at 2:30. Thank you.